Thank you very much, Mandeli, and thanks everyone. A great presentation, Ian Rain. It's always exciting to hear what's happening in the world of nuclear. Now, I am the founder and MD of Totoma. We're an SME involved in a number of things in healthcare. One of the areas of focus for us is, of course, the radio-pharmaceuticals. We identified this as a strategic area of focus for us for a very simple reason. I mean, with those who don't know, South Africa is a powerhouse when it comes to the nuclear sciences. With Safari 1 having been around for, I think it's 54, 55 years now. And as Jan Rain said, one of the most significant suppliers of radioisotopes in the world. And of course, you don't have to look further than a research publication to ascertain the depth of expertise that we have in our country. Now, in the context of Africa, I mean, we all know that African patients face a lot of barriers of access to cancer treatment. There's limitations in terms of awareness, access to diagnostics, funding, healthcare capacity, and of course, limited availability of effective therapies. I always say the problem with modern biopharma is drugs are developed for North America, the top countries in Europe, Japan and Australia. If those countries or those regions can afford, then the pricing model works, and very little trickle down happens. And I mean, even decades after these technologies are launched. When you look at survival rates of cancer in Africa, they're far worse than that of high-income countries. I mean, as an example, 5-year survival of women with breast cancer in Europe is 82%. In fact, in North America, it's even higher. Whereas its survival in Uganda is 46%. As little as 39% in Algeria, and a shocking 12% in Gambia. So the burden of disease and a confluence of all these challenges is actually killing people. It's killing Africans who get cancer. And our mission as Totoma is to contribute towards making effective and affordable treatments more accessible in Africa. And our particular focus area is on the leveraging of radioisotopes through targeted investments and commercialization. I think the introduction does cover this quite well. And when we're looking at the state of cancer and nuclear medicine in Africa, if you look at installed capacity per million of the various, whether it's imaging or treatments, there's room for improvement. It's very, very limited. But when you look at the distribution of frequently most frequent cancers in Africa region, we suffer a lot. Our people are heavily impacted. And as populations or life expectancy improves, we'll see a lot more cancers. So there's a need for us to work together in ensuring that meaningful access to diagnostics and therapeutics and theranostics is there. Now, I was asked to just give a case study a short case study on how do we leverage the power of nuclear isotopes in the cancer area. And I'll give an example of an active treatment in skin cancer and keloids, which we have launched in South Africa recently. And we'll look at the role in which this plays. So why skin cancer? Skin cancer is one of the most common neoplasms in the world. In fact, when you look at global stats, they always quote cancer statistics, and they put a disclaimer there, excluding skin cancer or non-melanoma skin cancer, just purely because of the very, very high prevalence. In fact, South Africa is the second highest incidence of skin cancers in the world. But our technology only targets the superficial types of non-melanoma skin cancers, which is the basal cell and the squamous cell carcinomas, which are quite common. But basal cell carcinomas affect mostly people of Caucasian descent, and we see a lot more of squamous cell carcinomas in people of African descent. And this just highlights the various treatment options that are available, which includes the medical and surgical management, and of course external beam radiation, and to a large extent for the superficial, less complicated cancers, topical chemotherapy is used. So we launched the Rhenium-188 radioisotope therapy at Steve Biko on a pilot basis, and it has since been more routinely used. We treat quite a bit of state patients and a lot more military patients. And I mean, if you look to the left-hand side, this is just the type of equipment that is involved in the treatment. It's a medical device that's registered with SAPRA, and we apply this topical radioisotope into the affected cancer. I'm not going to dwell into the technical details of the preparation of the lesion area, and all the other stuff that is done in preparation. But this 72-year-old male patient had a BCC, was treated at Steve Biko at Prof. Mike's unit. And the beauty of this, this is a single therapy treatment, which is when we tell the dermatologist and the plastic surgeon, it's almost unbelievable. This patient here had one session for their treatment, and you can see they had a very extensive lesion in this area. So they get treated, and over time, I mean, you see the lesion completely fading away with no damage to healthy tissue. And this patient could have had surgery, but the outcome would have been, from a cosmesis standpoint, not very positive. In fact, they might have needed a skin graft, which is one of the limitations of usual care when it comes to treatment of such lesions. The other application that we're working hard on developing, and this is an Africa-wide problem, there's publications which speak to the prevalence of keloids, on dark-skinned people. In some epidemiological studies state that the incidence could be as high as 16% in dark-skinned or normal pigmented African people. I mean, we have all seen a lot of people with keloids. I mean, there's various etiologies of it. I mean, I've just given examples of the published by Wang in 2017. And when you look at these, interestingly, they mirror what we've seen at Steve Biko from as early as 2020. And that's just where a bulk of the keloids come from. And now, why are we interested in keloid treatment? Usual care has limitations, steroid injections, cryo, and a whole host of other options that the patients get promised have a very high recurrence rate compared to what we've seen with the rhenium therapy. I mean, this is just an example of a patient who was treated at Steve Biko. In fact, a lot of the work that we've done will be published. I mean, the pigmentation on this lesion does normalize over time. And also, for most patients, it's just a single session therapy. Now, our plan is in as much as skin cancer is not that prevalent in the rest of the continent, keloids are. I mean, you don't have to look further than a lot of the regional publications that speak to the problem, the burden of keloids. I mean, we'll be launching the rhenium therapy in waves, obviously starting in the SADC region and then expanding all the way to north of Africa. And we hope to, maybe it's important to mention The problem with keloids is not just a cosmetic challenge. A lot of these patients suffer from incessant pruritus, the skin itch. We had a patient from Zimbabwe, 70-year-old patient with extensive lesions from the burns. He says that when this keloid itches at night, he wishes it would peel off his skin with a knife. For a man to say that tells you the extent to which this is a problem. And we see a lot of younger patients as well. It affects them at school, and they're painful. So treatment modalities that provide better outcomes for patients are needed. And this is one way which we hope to help with this dermatological condition. But skin cancer and keloids may be a way of entering for us and making sure routine use and that our team knows how to partner and how to activate the ecosystem. There's also a lot of future options with rhenium, and in some circles, the rhenium-188 is regarded as a poor man's isotope. There's quite a number of applications that have been worked on in the past, and we hope to do a lot more work with the local science and clinical medicine community to ensure that these are made available. And of course, partner with many treatment centers around the continent to provide and expand the use of this particular isotope, as well as others that we can gain access to from the research partners that we have. I think that's in a nutshell, just an example of how a small South African company is trying to leverage the power of radioisotopes to offer more treatment options for cancer management. Thank you very much.